Hi everyone, it's Christine. I have been up since 4:30, quarter to 5 this morning because I have my PET CT scan today to check on my cancer. So I had to get up so I could eat because you can't eat, you can only eat up to 4 hours prior to the test, which would have put me at 6, but I also had to have my coffee. So I am a bit tired, and it's going on 7:30. I am on my way down to St. Luke's North to the hospital. I have to go to interventional radiology to have an IV line put in. They use a guide wire because on me, my veins are very extremely scarred from all the PICC lines I've had, all the IVs I've had, all the blood draws I've had. They even have a hard time drawing blood on me. I usually walk out looking like a voodoo doll. And I usually end up begging and pleading with them to not go in the back of my hand, which is the first place they want to go when they hear that you're a very difficult stick. I don't know why, but that is the first place they gravitate to, and I get very upset. So anyway, I have to be to IR by 8, which IR never usually takes me at 8. I'm usually waiting for a good 20 minutes, so even if I'm a few minutes late, it's okay. And then they're going to use an ultrasound machine and a guide wire, a really long guide wire, and a very long IV line. It looks like a spaghetti noodle when it gets pulled out. And then I have to be to St. Luke's North for my injection. And I brought a special blanket with me to keep me warm because it's important that you stay warm and you stay still and you don't talk, because if you talk and open your mouth, the radioactive material escapes out of your mouth and doesn't stay in your body where it needs to stay. So they usually put some, elevator music on, and I go to sleep for about 45 minutes to an hour. So, and then it's on the table for the rest of the day. And then over to the CAT scan department for the second half of the test. They give me contrast I have to drink and stuff, which the contrast they give me is not really as bad as it used to be. They actually mix it with Crystal Light. It's not that real thick, chalky stuff. So it's tolerable, but it still makes me sick. Makes me very sick. Sometimes I don't even make it home before I start getting sick. So, and there's a cop in Nazareth that can attest to that because she tried giving me a ticket. And I fought it in court, and I won. Because I was trying to get to a certain gas station where I knew exactly where the bathroom was, and I was going, I guess, 10 or 15 miles an hour over the speed limit. So she tried testifying that I had passed several other gas stations that I could have used, and my defense was, yes, but I didn't know where their restroom was and if they had a restroom. So I even brought proof that I had the CAT scan done that morning and so on and so forth. So the judge sided with me and I won. But yes, the contrast itself makes me very sick. This is a big PET CT scan for me because, as many of you know, I have stage 4 malignant melanoma cancer. It is the deadliest skin cancer out there. So this skin is big because it's been a couple of years since anything on my PET scan that they've removed ended up being cancerous. There's been times that the PET scan has lit up and they've removed things, but it was benign or whatever. It wasn't cancerous. My most recent removal was I had this huge, it looked like a baseball, size of a baseball, protruding out from in between my breasts. And it ended up that they had to take, and it was showing up on the PET scan. That was the thing, that it was lighting up right there. So once this thing started protruding, I was like, no, take it out. They were going to do a needle biopsy. I said, no, just take it out. That's how I've done it since day one with this cancer, is just resect. So they took it out. It was a xiphoid process, and because they don't typically biopsy the xiphoid process, but given my history with cancer, they did, and it was clean. That was a year and a half ago. So it's been a couple of years since anything has come back as being cancerous from the PET CT scan. With that being said, I progressed from having PET CT scans every 6 months to once a year. So the theory of the PET CT scans is that once you go X amount of time when nothing is cancerous that they're removing that's showing up on the PET CT scan, that they stop doing the PET CT scans until you become symptomatic. There was only a few times, and it was like 10.5 years ago when I first started battling this cancer, that I was symptomatic. I was in my last trimester with Nathan. Nathan just turned 10 recently. So I was in my last trimester with him, and I could not breathe. I was carrying very, very low. So I knew it wasn't the baby, putting pressure on my lungs or anything like that. And it turned out a few weeks after he was born, they found several tumors in my mediastinum area, which is in your windpipe area. At that point, I was getting lost driving, getting confused. I'd be on the phone with somebody, and a few seconds later, I wasn't sure who I was talking to. I was having problems with my speech. Certain words, like I just couldn't pronounce words sometimes. So at that point, when it was in the mediastinum area, it was also in my brain. I was also having problems with nausea when I would eat, having a really hard time getting anything in me, and then they found it in my liver. So that was the only time I was symptomatic all at once. It was all of it all at once. I was having a hard time breathing, I was getting confused and getting lost driving, and I wasn't able to get anything in me. So all those symptoms were going on all at the same time because it was in all three areas at the same time. After that, after I went through treatments and surgeries to remove the stuff, I wasn't ever again symptomatic, but the PET scan picked up tumors. It picked up the tumor in my left femur bone, and that was growing really fast. And it was so noticeable, I'll never forget it, that as I was getting my clothes on after the PET CT, Dr. Fournier, the radiologist, came in and was like, "Did you fall?" And I'm like, "No." He's like, "Is your leg hurting you?" I'm like, "No." And he's like, "You're not leaving yet." Like, he put me back on the table to take more views, and it was growing very fast. I wasn't symptomatic. So my cancer doctor, Dr. Riley, who I am forever grateful to, because if it wasn't for him and his team at St. Luke's, I wouldn't be here. I can pretty much guarantee I would not be here. I would not have seen Zachary even turn 2, because Zachary was 1 when my cancer spread. I would not have been around to celebrate Nathan's first birthday. So I am forever in debt to them for keeping me alive for so long. With that being said, I struggled when we went from once every 6 months with my PET scans to once a year. I fought him on that, and he kept it once every 6 months for a year and a half, actually for 2 years, which is a year longer than what the protocol calls for. So then, he eased me into it. Then we went to PET CT scans once a year. And we've been doing that for a couple of years now. I'm not sure how many. But he dropped the bomb on me in my last appointment that if this scan comes back not showing anything and being clean, that we will no longer be doing PET CT scans. because it hasn't proven to be effective. I don't know. I don't know what the deal is, why it's like that. But he knew when I left there, yeah, that's not going to sit well with me. Because there was only one time I was ever symptomatic, and that was when the cancer was already in 3 major areas. So I'm not going to wait till I'm symptomatic, because then I'm going to feel like every little bump, lump, twinge, ache, pain, anything, I'm going to be like extremely freaking paranoid. I walk around paranoid now as it is. With losing the weight that I've lost, which I've lost track, I think it's 160 pounds now, I feel little bumps and nodules that I didn't feel before. And I'm like, well, is it just cellulite? Is it, another cancer? Is it really tiny tumors? Is it lymph nodes enlarged? You don't know. You don't know. And I've stayed so ahead of this beast. Because malignant melanoma, the survival statistics for stage 4, I don't know what it is now, but 10 years ago, it was 1%. You had a 1% chance of surviving 12 months. 1%. That is like horrific odds. You might as well tell a person they're going to die within 12 months. And in fact, when I first did get to Dr. Riley, I went to him for a second opinion, but when I finally did decide to stay with him, we were going to do high-dose IL-2, which had just been in the trial stages at that point. And I was not able to get into any trials because my HLA type was the wrong freaking type. So, Dr. Riley decided he was going to take a chance and do it on me anyway. Because even if it worked enough to shrink the tumors in my chest, small enough that they'd go in and resect them, then he would consider it a partial success, which it did. So it was a partial success. But at that point, even if the IL-2 worked, I was looking at maybe having 18 months to live. If it didn't work, I would have been lucky to have 12 months. So, that was a hefty load to have to hear when you have a 2.5-month-old baby and a 1 month old. He was 1 year and 1 month, and Nathan was 2 months and a half, I think. He was like 10 weeks old when we got this news. So, so back then, I went from stage 1 right to stage 4. And which is also rare. I think there was like a 4 or 5% chance of that happening, where it doesn't spread through my lymph nodes, it spreads through my bloodstream, and it just zigzagged. It went heyday on my body. I gave a speech at a Relay for Life several years ago, and did research then, and the research I found then several years ago was that one person dies every 24 hours or every 8 hours, I think I don't remember. I think it was one person every 24 hours dies from melanoma. And people with cancer, I don't think they don't technically die from their cancer. They die from complications from the cancer. Like I know from all the research I've done, a lot of cancer patients end up with pneumonia, and then it's the pneumonia that takes them. The pain, the fluid filling up in their lungs, they start retaining fluid throughout their body and get very swollen. Typically, that's what's been my personal experience. Whether or not that's true, I don't know. I'm not a doctor. I don't claim to be a doctor. So now I've lost track of what I was saying. So I don't want to wait till I'm symptomatic, I guess is what I'm saying. So when I see Dr. Riley in 2 more months, we're going to have a little talk about that, because that's not sitting well with me. So anyway, I thought it would be interesting to videotape my day as I go through this, and take pictures and stuff like that. So hopefully people that don't have melanoma have a better understanding, because a lot of people say, oh, it's just skin cancer. It's not just skin cancer. People die from this. Children die from this. Babies die from this. It is the absolute deadliest form of cancer that there is. There is no cure for this. They are just now breaking ground on finding treatments that are working. And the research dollars that melanoma cancer gets is literally pennies. If you were to look at the list for research studies and which cancers get the money first, it's lung cancer, colon cancer, breast cancer, prostate cancer. Melanoma research money is at the extreme bottom of the list, and that's sad. So, yeah, it's a very deadly form of cancer, and it bothers me when people downplay it. It bothers me when people are like, oh, that's just skin cancer. It is not just skin cancer. We are not talking squamous cell here. We are not talking basal cell here. And not that I'm minimizing basal cell and squamous cell cancer. I'm just saying that it's very rare that basal or squamous comes back malignant. It is extremely rare that those two ever come back malignant. So, yeah, it's not just skin cancer, people. People are freaking dying every single day from this cancer. And I realize people are dying every single day from breast cancer. My mother's a breast cancer survivor. I've had masses removed from my breasts, and I thank God that it wasn't breast cancer. But sometimes I kind of wish it was breast cancer, because I feel like my odds are better. Not that I'm looking a gift horse in the mouth for surviving as long as I have, because I'm not. I've lost very dear friends to this cancer way sooner than they ever should have been taken from this cancer. So, I don't want to go there right now because I'm driving, and if I talk about it, it's going to upset me and I'm going to cry. So, with that, I am getting on 22 West now, probably about 15-20 minutes from the hospital. It is now 7:46, so I will be a few minutes late, but they're always late taking me, so I guess it's my turn to be late. Anyway, I will check in again in a little bit. I hope you all have a great day. I am asking that you guys keep me in your prayers, because I truly believe that prayers work, and I will talk to you soon. Bye.